Hey everybody, Jamie Mathy from Red Raccoon Games here. I am on the board for the Community Healthcare Clinic, and the clinic, they asked me to do a little video to explain why I've been on the board for this many years and why I spent a lot of my time, treasure, and talent with the board. And I've been thinking about this, trying to figure out how do you explain such a thing, and I think there's two parts to the story. The first part is I grew up in Shabance, Illinois, very small town. Closest thing around here would be something probably like Danvers. And growing up, if anybody needed help, my dad said yes. My mom said yes. I can't tell you how many times we got thrown in the back of the pickup truck. We drove across town and we helped somebody move. We helped somebody build a fence. We helped somebody clean out a garage. Whatever people needed, if there was a volunteer opportunity, my parents said yes. And so I grew up with the understanding that that's just what you did. You just said yes and you helped people when you got asked for help. And so, that was just my whole childhood. I didn't know that there was another way to be. I thought that was just part of how it was if you were part of a community someplace that you cared about. I moved to Bloomington. I came to go to ISU just like so many other people, and I never got around to moving away. And I've been here for pretty much the most of the time since college. And in my 30s, I got asked to be on a ton of different boards. And I had time, I had talent in fixing computers and in organizing things. And I spent so many hours with so many boards and so many nonprofits all over the community. As we got busier, as life got busier, as our businesses got busier, Kelly and I had a purposeful conversation to sit down and say, where are we going to make the most impact? If we don't have unlimited time anymore, what can we do to make the most impact in the community, to leave the community that has adopted us a better place when we get all said and done? And so this is where part two of the story comes in. I told you I've been here most of the time since college. I did go to Chicago for a while, and I took a job in Chicago. And after the 9/11 happened in 2002, the entire economy kind of slid into a recession. And I walked into work one day, and there was a team meeting, and they said, everybody's let go. We're shutting down the whole building, and they fired 500 of us on that day. And so something else you need to know is I have extremely bad seasonal allergies. I am allergic to every type of grass on the planet. And you know that wild grass that grows up and down every highway in Illinois? It's called Timothy grass, and that's the number one thing that I'm allergic to the point that for about 8 weeks every year, I can't function without my meds. And so I no longer had a job. I had an extremely expensive apartment because it was in Chicagoland that I was trying to figure out how to get out of a lease on. Everybody was laying people off. There was no work to be had anywhere, and my allergy season came up on me, and I didn't have any medicine. So I found a free clinic in Chicago. I didn't know they existed. I'd never needed one before, but I found one in Chicago, and they got me my prescription meds so that I could function to go to job interviews and try to find a job. And so, eventually I ended up back in Bloomington because Bloomington's way less expensive to be unemployed than in Chicagoland. One thing leads to another. I get married to Kelly. We have, started our family and everything like that. And one day my friend Vicky says, hey, Jamie, there's a fundraiser luncheon coming up for the Community Healthcare Clinic. Would you come? Would you spend some time with me and come to this luncheon? And so I say yes to Vicky. And I saw the presentation. It was by Angie McLaughlin, our former director at the time. And I was like, this is amazing. This is just like the clinic that saved my bacon when I was in Chicago, got me my meds when I was down on my luck. And I volunteered. I started volunteering immediately. And I think that was like 7 years ago, maybe 8 years ago at this point. And then I got asked to be on the board, and I've been on the board ever since because it's what you do. It's you give back to the community that you live in, and you take care of the community that you live in. And I think that the Community Healthcare Clinic is one of the organizations in town where you can have the most impact on somebody else's lives. So that's why Kelly and I spend a lot of time. I'm on the board, but she comes to all the fundraisers, and we invite all of our friends, and we try to educate people about the community healthcare clinic. I think it's one of the treasures in Bloomington Normal that a lot of people don't know exists, but there's a huge population of Bloomington Normal that depends on the clinic for their well-being. I tell people that the clinic takes care of the working poor. Most of our patients that we take care of work full-time jobs, and they still have to choose at the end of the day between their own care and maybe feeding their kids or paying the rent or paying their bills. And I'm incredibly proud to be on the board. I'm incredibly proud of the work that we do to take care of those people that just need that boost. We talk about giving that hand up, and that's exactly what we do for so many families in Bloomington Normal. So yeah, that's my story, 2 parts to it. If you've got time, if you've got talent, if you've got treasure, we need your help. We always need your help. We are always looking for volunteers. We are always looking for people that have skills that can help, particularly if you're a doctor or a dentist, that can help at the clinic. Or if you speak multiple languages, we always need translator help. And if nothing else, your treasure. I know it's all hard earned. We all work every day very hard for our money. This is an organization. For every dollar that you put into it, $15 comes back out in benefits. The clinic on average saves $15 million to $16 million from people who would end up in the emergency rooms in very dire situations. We save $15 to $16 million every year. So yeah, that's my story. That's why I stay involved. This is why I love the clinic. This is why I agreed to be the president next year. I don't know if they know what they're in for, but yeah, I hope that this finds you well. I hope this finds you in a state of mind where you can think about where are you going to make the biggest impact in someone else's life. Have a great day.